I've read a number of articles that look at different roles in industry and in healthcare and what roles are likely to be replaced by AI, and they are not nurses. And the reason is because of the critical thinking that comes into our practice, but also the human connection. The last thing a nurse manager needs to be doing is to be stuck to their computer worrying about the schedule. We know that 85% of clinicians report that they want and have to have a greater voice in software decisions and in AI decisions. There is ambient listening technology now that a number of health systems are using, where when a nurse goes into a room, it actually records the entire interaction you have with the patient. The nurse said to the patient, is there anything else you need before you go back to the OR? And she said, yes, there's one thing I need. She said, pray with me. And the nurse stopped and prayed with the patient, and the patient felt better about that. And ambient listening picked up all of that and said, spiritual needs of patient addressed, identified and addressed. And it was time spent with the patient that was critical. Now, AI can't do that, right? But what it did was it picked up.
Welcome back to the podcast. I'm your host, Kati Kleber, and today we're talking about a constantly evolving and important topic in healthcare, AI. But we're talking less about what AI is and more about how to use it to make nursing better. That means things like safer care, less busy work, more time at the bedside. My guest today is Susan Grant, Chief Clinical Officer at symplr and a nationally recognized nursing leader. She's led major initiatives in clinical excellence and patient experience at Wellstar, Beaumont, Emory, and the University of Washington Medical Center and Dana-Farber. She serves on the American Academy of Nursing Board of Directors and sits on the Daisy Foundation Board. Her focus? Tech that actually centers clinicians and patients. In this episode, we're going to reframe AI anxiety into practical action. Susan shares with us why AI won't replace the human parts of nursing and where it should replace administrative friction. A powerful story of ambient listening that captures real nursing care that you never have time to chart. The single biggest mistake that leaders make when rolling out AI, and how to build trust with things like shared governance and nurse-led design. And finally, what a nurse's day could look like in 5 to 10 years if we implement this right. If you're a bedside nurse, educator, or leader wondering how AI can help and not hinder your practice, this one's for you. Let's dive in. Well, thank you so much for joining us today on the podcast, Dr. Grant. We're so excited to have you here. You have such great experience in the nursing realm. My goodness.
Oh, thank you. Thanks. It's great to be here.
Well, I want to jump right in and start talking AI. What a big topic it is. I've spoken to a few different people about AI and how it will impact the nursing realm. I think about it like just in a big picture, like almost like how the internet like impacted culture. It took time to like really integrate into like a lot of processes, but boy, it does like completely change the world. And I feel like AI will likely have the same sort of cultural impact that's like pernicious into like everything that we do almost. Now, I wanted to know, like, especially in the healthcare and for nurses tend to feel, I think, like AI might replace them, maybe replace the human side of nursing, maybe feel anxious about it. What, from your perspective, is the most misunderstood thing about AI for frontline nurses? Like, how do you reframe anxiety and fear maybe into like curiosity or something where they're not like hesitant about it, especially for a leader who is probably leading the charge into implementing some AI features at the bedside?
Yeah, so that's a great question. I actually just came from being on a panel at the American Association of Colleges of Nursing over the weekend in Washington. And this is exactly what we talked about. And, I love that question because there has already been some research that has begun, and I believe her name is Olga Yakasheva, or I never pronounce her name correctly, but it's a wonderful study that talks about, those things that can help support nurses in practice, but not replace them. And I've read a number of articles that look at different roles in industry and in healthcare and what roles are likely to be replaced by AI, and they are not nurses. And the reason is because of the critical thinking that comes into our practice, but also the human connection that we make with patients and families that help us to, pick up from an assessment standpoint changes in a patient's condition, that we are able to, when we connect with patients and families, what is most important to them that actually impacts their outcomes. Those are things that AI cannot do. And that will never replace nursing. And that is unique to nursing. And so, I would say to nurses, let's talk about more around and involve nurses in the discussion around what do they believe can be taken out of their workflow to support them in providing patient care and doing what they show up to do every day, so that nurses really inform how we use AI. I think that's the difference, that we have to be able to inform how AI is used and what it's used for to support our practice, not to replace us.
That reframe, I think, is very powerful, because as you were talking, it made me think of in nursing school and at the bedside, so many times, you ask this question about the patient, and so often the answer is, well, it depends. And patients are so dynamic and
Yes.
different, and they're not, that you use the textbook as a guide, but patients are so different, and they have all these different overlapping things, and you really do have to look at everybody so uniquely, which is the frustrating thing as a new nurse, because you just want to be told the exact right thing to do all the time.
Yeah.
And it takes a while to develop that critical thinking piece. But I'm like, and even in my experience with using AI, there's so much nuance in nursing constantly that I don't think, how could that ever replace that? So I love that reframe of okay, reassuring, this can't replace you, because the very complex things about your role that are frustrating, that are complex, but because you're awesome and you master them, that makes you invaluable. So you did mention there, what roles like you said, there could be other roles that are replaced. What are some of those other roles?
I think they're more technical roles that, I think about things like this is not to replace, it's to take off workload. I think about nurse managers as an example. They're the linchpin to health systems. And, there's so much on nurse managers to create a better work environment for the nurses who work within their area or scope, of responsibility, to provide safety, and ensure that care is delivered safely, that outcomes are where they need to be, that the patient experience is what it needs to be. That's all on the nurse manager. The last thing a nurse manager needs to be doing is to be stuck to their computer worrying about the schedule, right? And staffing. Those are things, that doesn't require a nurse to do, and nurse managers know it. They're like, this is administrative busy work that we do not need to be doing as nurse managers. Now, do we need to oversee it? Yeah. And make sure that, we have the right nurses on the right shifts, and, that, we don't have too many new grads on one shift, and, no experienced nurses, especially when your patient acuity is really high. Yes, those are things nurse managers want to oversee, but even that, AI can help nurse managers and support nurse managers so that they're not spending all of their time worrying about that. They can help with predictive scheduling. AI can help with predictive scheduling. There are all kinds of things that really can assist nurses in doing their work. So it's those technical things and clerical things that I think AI can really help with.
One of the things, like, I did not ever have a manager role myself, but when I was doing my master's, and I've spent time with some nurse managers, and as a new nurse, I did not appreciate the sheer amount of administrative work being
Yes,
being
yes,
in the assistant manager, and how much of a time suck it really is, because
yes,
there's so scheduling, and then things like making sure everybody's license is up to date, their certifications, this is expiring, this
exactly.
education is due for mandatory, this CMS thing or whatever. There was just regulatory stuff, getting ready for this and that. And there was I was blown away. Like, there's got to be a better solution for these people with often master's
Yeah,
degrees, high
yeah.
experience levels in nursing, and they're glued to a computer, and they can't round because they have to get this certain thing done by a deadline because Joint Commission's going to be here next week, and these
Yes, yes,
check boxes need to be done. It
yes.
just felt so absurd.
And you just described it perfectly. Those are the things that I think AI could actually be instrumental in transforming the work environment where nurse managers can be present for their nurses
Mm-hmm.
and ensuring that they have a connection with the nurses they lead, ensuring that that connection translates into knowing who your nurses are and
Yeah.
what they want from a professional development standpoint, and really changing their work experience within the work environment,
Mm-hmm.
making sure that they have the skills and they're developing them. Those are the things. And then I think, about as a direct care nurse too, the amount of time direct care nurses have to spend on documentation, that takes them away from their patients. And that's why we as nurses come to work every day. It's to make a difference in our patients'
Mm-hmm.
lives. Well, you don't feel like you can do that when you're stuck to documenting, or as you said, Katie, about, meeting those requirements and documenting really to meet compliance standards.
Right.
That's what it feels like, right? It
Yes.
doesn't it doesn't feel like it's, always contributing to improving your patient's outcomes or improving their experience or creating that connection with them. So I think that's where AI can really make a huge difference, and already is. There is ambient listening technology now that a number of health systems are using, where when a nurse goes into a room, they can it actually records the entire interaction you have with the patient and their family. And I have a colleague who shared this really powerful story about how a patient had to go back unexpectedly to the OR after having surgery, and they had to go back
Mm-hmm.
unexpectedly because of a complication. And the nurse went into the room to get them ready for the OR, and they were doing everything they're supposed to be doing, making sure the patient had what they needed. They were checking off everything, labs, all of that. And then the nurse said to the patient, is there anything else you need before you go back to the OR? And she said, yes, there's one thing I need. And she said, pray with me. And the nurse stopped and prayed with the patient. And the patient, felt better about that because that's what they needed, because they were afraid. And the ambient listening picked up all of that and said, spiritual needs of patient addressed, identified and addressed. And it was time spent with the patient that was critical. Now, AI can't do that, right? But what
Right.
it did was it picked up what nurses do. That, how powerful is that? We've always had trouble articulating in a consistent way what nurses do and the value of nursing. Well, if AI can help us do that, how powerful is that? How powerful it is to be able to, over millions of nurses to be able to capture the value of nursing and the impact nursing has on patients, their lives, their outcomes, and on the healthcare system in general.
Yeah, you don't want nurses and people to like you think of the vast amount of tasks you have to get done, and
Yeah.
and including the spiritual one, like you to have to type everything that you did. It's just
Yes.
so
Yes.
exhausting. And it honestly, at some point, you're just like, I honestly don't want to do more things because then I have to type more things. And I don't want us to get to that point of
Exactly.
it's, just record this and put this and put this. And there's so many requests that I remember feeling like, wow, I keep getting asked to chart more and more and more and more and more and more. And but I'm not getting more time to do that. Not that I want to work more than 12 hours at a time, but
Right.
I felt like, boy, the requirements just keep going. So to say, hey, there's this tool that could observe what you're doing and record it all for you. My
Hmm.
goodness.
Yes.
My goodness.
Well,
I mean,
and the
go
nurse,
ahead.
yeah, and the nurse, went back and had to obviously approve what it had
Yeah.
reported. And what she said was, I never would have documented what I did.
You know, as you
Right?
were saying that story,
Yeah.
I did that once. I
Yeah.
had a patient in neuro ICU that had to go to an emergent craniotomy, and the wife, and he was unconscious. The wife was upset, distraught, like her pastor was on his way, but we were in like a busy downtown area. It was going to take a while for him to get there, and she would not go to the OR until somebody prayed for him.
Yeah.
So in front of like all these people, I
Yeah.
prayed with her, and I didn't document that. I did not write
See?
that spiritual care was provided, but boy, I did. And
Yes.
that was something for me that I
Yeah.
remember
Yeah.
probably 10 years later.
Yeah.
Like
Yeah.
I would have literally never, I didn't document it, and I probably would not have, I don't know, I just wouldn't have thought to document that. But boy,
Yeah.
yeah, you
Yeah.
really are really meeting those needs.
Yeah.
And you're talking about how the nurse manager at the bedside, or the nurse manager, because they're doing all this work on the computer, they're not able to be plugged in with their staff in a way that really does develop staff. It really reminds me of like an athletic team. And I've always viewed the nurse manager like a head coach.
Yeah.
But instead of being coaching on the sideline, they're sitting down, like looking at numbers, and the team just kind of has to lead itself because the person, their coach, has to do all this. And it's like, if there's a tool that can take care of the numbers for the most part, that the coach, and they can actually step up and
Oh,
coach from the sideline, how much more supported those bedside nurses are. Like that kind of stuff
that's
to
right.
me downstream is like impacts turnover, impacts
You bet.
people leaving all, like, because they're
You
not
bet.
getting the support that they need, because they're not getting connected with their leader and getting that kind of guidance that they really need to be successful.
Yeah.
So to
It
have like,
contributes.
yeah, like have a tool to like do that, and then also help with the documentation is unbelievable. That would be, oh boy, that's a different world.
Yeah.
I mean, that
It,
really would feel like a different world.
it really is. We did a survey recently at symplr of our clients, and we probably had about close to 450 to 500 people respond to it. And what they reported was that clinicians on average, to your point, on average lose 88 minutes per day to administrative time. Think about that. I mean,
Yeah,
that's a lot of
that's
time.
that's a lot of time.
And when you're, and you just hit it on the head. Um, it really, that time spent is taken away from patients, taken away from what's most important to clinicians, patient care.
Mm-hmm.
And it really does fuel burnout, turnover, big dollar consequences really for
Yeah.
health systems. And so we're talking about also a return on investment, that it's not just something, oh, this is going to be a nice thing. No, it's transformational from a work environment standpoint, turnover, burnout, patient care, patient outcomes, and from a cost standpoint as well.
Yeah, I think transformational, that's a very good word. to describe, I think, probably the AI lever when it's implemented in the right way, I think.
Mhm.
Now, trust, though, with technology, a lot of people do have
Yes.
challenges with trusting it. And you definitely can't just put in a policy and say, here you go, it's fine. It really is built in like the gray zone of like workflows. So what have you seen leaders do, maybe intentionally or even instinctively, to help nurses and maybe leaders feel heard and safe and reduce skepticism as new tech, especially something as advanced as AI, is rolled out in the clinical environment?
Yeah. Well, this is something I'm very, very passionate about as a nurse leader. Nurses have to be involved in the creation of whatever AI and identification of how AI is going to be used. Nurses have to be involved. And it's nurses, from the direct care standpoint all the way into administration. Nurses must be at the table in making those decisions and partnering with IT, your digital health folks, your chief financial officers, and your finance people, to really have the dialogue about how it will be used. So I think those things and what I've seen work is very strong partnerships with the chief nurse and the CIO within health systems, but all the way through to, your nurse managers and your staff nurses being involved in shared governance and having nursing informatics councils that are not only nurses, where we're talking to ourselves. We need to make sure that they're multidisciplinary and multi-departmental, so that you get that cross-sectional, of different departments and people who are making decisions, so that you're doing it collaboratively. I've seen that really be transformational. I have a quick story I can share. When nurses were not involved, I remember we had something, I'm not going to name companies, but
Of course.
we had an electronic health record that offered a technology using AI where it collected data within the electronic record that would forecast, and this could help, that could forecast whether or not a patient would deteriorate. And it was quote unquote turned on. Nurses were unaware of it, and it started to show up, and nurses were not, because they weren't aware of it and they didn't understand how it worked. It started to collect data, and it appeared as though nurses were not intervening soon enough for the patient. Well, that's not exactly what was happening. Once the nurses understood the workflow and the data that informed those predictions, then they were able to use it in a constructive way and meaningful way. But prior to that, it was kind of, they would say garbage in, garbage out.
Yes. Yeah.
That's what it was. And that really kind of fueled, along with a couple of other other situations that occurred, it fueled the importance of the partnership with informatics, IT, and clinical, and direct care, and how important that those partnerships and collaborations were in using AI in a meaningful way.
Yeah, I mean, and you think about like nurses providing care, so many things have to happen from so many different departments to provide care appropriately. When I was in Charlotte, I did shared governance too, and it was eye-opening to see, like, you as the end user, you're almost kind of blind to all of these deep processes that have to occur for you to be doing what you're doing with the patients at the bedside. And I love that you mentioned the shared governance aspect, because it pulls in the nurses, but then also an interdisciplinary thing,
Yes.
pharmacy, nutritional services, like
Exactly.
everybody from because so much touches the patient, and there's so many barriers that can happen and I do think nurses do, like, we're so into what we're doing, it's hard to fully appreciate the vast amount of stuff that has to happen to get the med to you, to get the enteral feeding to you with all of the correct supplies and the correct pump that works correctly, that was checked recently, that's delivered to your unit. Like, so many things have to happen. So having being able to appreciate all of that in a setting with like AI, I think definitely would really increase trust, because you do have to have those nurses at the bedside to appropriately roll that stuff out, as well as everybody else. Have you seen any, I guess my next question was, have you seen any mistakes in AI rollout? Well, that was one.
Yeah.
That was definitely a very good example of a mistake in an AI rollout situation.
I would say too, it's AI and technology, they go together. And another example too, it's just to emphasize the importance of involving the people who are doing the work and who understand the workflows, how important it is to involve them. I was several years ago, I was in an organization, and we went live with a couple, iPhones, which, at first was really exciting. And then it was like, oh, well, you can't put everything on these things because there's a problem when you do that. And so, but we didn't know what those problems were. And, you talked about trust. I think the reason why nurses don't trust it is because for so many years when technologies were introduced, nurses were not involved in the creation of those technologies and informing what the workflow should be and how it would impact workflow. That then when they went live, nurses were the ones having to work the bugs out in the system.
Yes.
And then it created more work instead of helping them. And so, of course, nurses don't trust AI or different technologies. That it makes sense. And so, we had this situation where we introduced iPhones and clinical communication with amongst the team, and it was really good and everything. And then we had a bed management system that also went live, and we had all these things, clinical communication, alarms, all kinds of things coming through the iPhones, right? And when the bed system went live, what we learned from the nurses, I was rounding one day and I said, so how's it going with the iPhones? And they went, it's okay. And I thought, oh, wow, I thought you guys would love it. And they go, well, here's the deal. And, nurses tell you exactly what they think. And so
they sure do.
Right. So they go, here's the deal. When I text Dr. So-and-so, if there's a bed that is being cleaned or opens up or, is available, those messages come into my phone and they override the clinical communication. So I have to wait until those bed alerts are finished before I can communicate, and I can call my doctor or they can call me. And I said, wait a minute. Whoa, wait.
That's a barrier.
Exactly.
Oh, Lord.
And I said, oh my gosh, did you guys escalate it? And they said, yeah, we did, but we haven't heard anything back. And I was just like, oh my gosh, that's a patient safety issue.
Yeah, did they go back to just using their regular phones at the nurse's station? Because that's like, if I have to wait for notifications and things to stop, I'm not going to wait for that to happen to, oh my Lord.
Yeah. So I think again, and that actually really was such a great example, because IT was like, oh my God, and they felt terrible. They were like, we didn't understand or appreciate what that meant.
Yeah.
And, because we speak different languages. And so, we know, and in a recent survey we know that 85% of clinicians report that they want and have to have a greater voice in software decisions and in AI decisions. Mm-hmm. And that's up like 13% just from 2 years ago. So it gives you an idea of how quickly things are moving and how important, again, I just can't, I'm very passionate about it, because nurses know things that none of us, when you're providing direct care, and you know this, Katie, from being a direct care nurse yourself, it's nurses know things that others will never know until they do the job. And that's why it's so critical to involve them.
So when I think about like technology like that, and I think about things like when I started in this neuro ICU, we were on paper charting, and we, when you had to go do your every 15-minute vitals, you wrote them down, and then we moved into another unit where everything, like the pump, it would take your blood pressures and it would auto chart them, and then you just had to check them off. That was like such a, I quickly went from, I can't imagine using that to, I can't live without it. That, like, I mean, obviously you'd still use your critical thinking to make sure, and you do double check things. But I'm curious if you have a success story where a staff went from maybe resistant to engaged, or went from skeptical to, I can't imagine working without this, and what kind of made a shift like that possible, but with AI.
Yeah. So there was, patient experience is it's a constant thing that we work on in health systems. And sometimes it's really hard to kind of move the needle on patient experience when you know that you've got all of these workflows that are so complex and you don't have control over them as a nurse. We introduced a technology that nurses could use when they did their rounds. And when they worked with their patient, you could enter, data about your patient and their experience, like everything from, what their preferences are from a meal standpoint to also you could have information in there about, last time they were here, their discharge was delayed because, I don't know, the doctors didn't get there until 6:00 at night to release them when they were ready to leave in the, first thing that morning. How often does that happen, right? Mm-hmm. So this nurse was like, okay, I'll use it, whatever. And she went in and she had all this information about the patient. First of all, she said to the patient, "Hi, Mrs. Brown. I see you were here with us 3 months ago. I'm so sorry we're meeting again, and that you're back in the hospital." Well, first of all, Mrs. Brown was shocked that she knew who she was and that she had been there 3 months ago. Second thing she said to her was, "I see we had an issue with discharge last time. We're going to make sure that doesn't happen again this time." So she was double shocked that she knew that. So this nurse came out after she had, and of course the interaction was a lot longer than that, but she came back out and she said to her manager, she goes, "Oh my gosh, Mrs. Brown was like so surprised that I knew who she was." And she said it was fantastic. I really, really made her feel and made a connection with her because she knew that I knew her. And she said to her, she knows me. They know me. They know who I am. And then the best part was she goes, "It really made me look good." And that was the part where I almost started crying because I was like, it's giving people the tools to be successful,
and
right?
And when you're newer and when you're overwhelmed, see, that's not something that required you to analyze 4 lab values and have this complex conversation to look competent. And that is one of the things that new grads or not even new hires into acute care, they're looking for little wins to be able to look competent, especially when you've got these, especially people who graduate from nurse school when they're 20 and they're younger and they want to look like they know what they're doing. And things like that can help give them quick wins, build confidence, and then it helps that patient lower their anxiety, increase their trust, and it just helps that whole patient nurse interactions just go smoother because they know what they're talking about.
Yes.
They knew I was here. There's some degree of continuity of care. Because, right, like without that, I would have had to go look at their previous encounters, find their discharge note. And even if there was a discharge note, would they, I don't know that they would have actually put in there this, and this. Like to be able to access that quickly and just like confidently like, I see that happened. And like, that doesn't take like this 20-year experience nurse to be able to have that quick interaction to build trust
Exactly.
and rapport right off the bat. Whew,
Yes.
that's
Yes.
powerful.
It is. It is. I mean, can you imagine if you went into a patient's room and you knew that they fell last time they were in the hospital, or, or
Yeah.
we discovered a new allergy while they were there? I
Yeah.
mean, it goes on, and to create that personalized experience
Hmm.
with a patient, I agree. I mean, that is powerful. And to have a nurse say, it made me look good, that's where we need to be focused. And that's what transforms the patient experience and the nurse's work environment experience.
Yeah, it's like that's the stuff that's not shared in report, which is where you get your currently clinical information. But it is that like that stuff that is important and very important to patients is like especially repeated admissions and things.
Yeah.
Having those things to be able to speak to them at top of mind for those bedside nurses is so powerful. I
Yeah.
love that.
Yeah.
I love that. So how can educators and leaders prepare new nurses? Now, yeah, we're talking about new nurses more as an advantage rather than a threat, because, well, I guess not necessarily even as a threat. When nurses are entering practice today, I want them to have skills and the mindset to be ready for AI, as well as leaders being shaped in how it's used. So I'm curious if you have any thoughts about how schools, maybe even preceptors at the bedside, can normalize AI literacy without overwhelming new grads who are still in that phase of mastering bedside skills where, yes, AI is great, but I can't put an IV in yet, those kind of things.
Yeah. I love that question. I think it starts first when you said AI literacy. It's also kind of upskilling and bringing our current workforce and faculty, upskilling them in terms of their own knowledge of AI, because we're all learning at the same time. So that's a little bit different,
Yes.
where as a new grad, from a clinical standpoint, you're working with nurses who typically have highly developed competencies and skills,
Mm-hmm.
who can teach you. Well, right now, many nurses are still learning AI. So we're kind of changing the wings on the plane as it's in flight.
Yes.
And so really working with healthcare systems, it's an opportunity for schools and healthcare systems to partner and to create those academic practice partnerships to learn together, and also to involve industry. So companies like symplr, we actually are, we started our first academic practice partnership recently with the University of North Carolina, Wilmington, where we have a doctoral student, a nursing doctoral student, who's working with us as her doctoral project to learn about the technology and the AI side, the industry side of the world, so that she can actually be more prepared in leading in a health system when she graduates. So, and she also is teaching. So, teaching, within her school. So, I would say those are some of the things that we can do. I think we need to think differently about clinical placements. Also, I'm working right now. I had a school reach out to me asking me if we would be interested in being a part of their kind of building, if you will, a simulation hospital within their school. And they not only want to simulate, clinical processes and competencies, but all of those administrative things, because like the non-clinical workflows, right? So kind of what we were talking about, scheduling, supply chain, um, you know, the credentialing piece, licensure all of that, the
Yeah.
quality, safety, compliance, all of those things that nurses have to deal with on a day-to-day basis, but they're unaware of when you start as a new grad. And that's part of that culture shock when you come into the clinical environment. You're not aware of all those administrative tasks and that burden and the time you spend, those 88 minutes a day that you spend in
Yeah.
administrative. So they're talking about simulating those types of processes as well, in addition to the clinical environment, to make it as real as possible so that transition to practice is smoother. So, and I would just add really quickly that, those non-clinical workflows, I think in terms of, where we'll see the biggest impact and the fastest is there first with AI. That, when you talk with healthcare leaders, they will say that that's where the real promise is in the immediate future of transforming health systems. It's in those non-clinical workflows and taking that out through the use of AI.
Oh man, that is like, a lot of my educational resources are to support that transition to practice, because so many of us have problems integrating the non-clinical aspect. That it's like you kind of knew that existed, but in nursing school you're so focused on the clinical aspect and learning those things that it really does, boy, that hits you. It's quite a shock of all these things that you didn't think about that you have
Yeah.
to do. And then you're like, like you're like drowning in what you didn't know. Like, how do I make sense of this? And then you finally get to that point, and suddenly you're 2 years into your career. So that,
Yes.
if you haven't left, because so many people, now that might not be the only reason they leave, but I'm sure that is a factor in the reality shock and I don't want to do this, and people leave, and we don't want to, there's alarming statistics of how fast, or whatever it is, 18% leave within the first year, and like, what is it, up to 33% in the second year? And
That's right.
we gotta fix that. Like,
Yes.
and it's promising to hear that AI could have move the needle the most meaningfully in that, because I do think that really impacts whether or not people want to stay, because they like, I want to just take care of patients. I don't
Yes.
want to do all this other stuff. Understandably.
Yes.
So I
Yes.
think that could be, and I don't know that it's realistic for it to be eliminated, but even minimized, would be a great step in the right direction.
Absolutely. Absolutely.
So let's fast forward 5 to 10 years from now. I'm talking to you and we're doing another podcast episode, and you're giving me an update on what the day of a life of a nurse at a hospital, maybe in a med surg or an ICU unit, or a leader. How does that look different from today?
Well, if we do it right.
Oh yes, let's assume we've done it right.
Yeah. Okay. So, assuming we've done it right, if we were talking to nurses, they would say, we have the time to do what we're supposed to do and work at the top of our license and bring the absolute best of nursing to every patient we serve. That's what I am hoping for and envision, that that nurses will be doing what only nurses can do and be fulfilled in that. That we will see better work environments as a result of that and lower turnover. But we'll see, most importantly, better patient outcomes as a result of that, and better patient experience.
That's my hope, is like I've seen some things about, like you mentioned, that predictive technology earlier. Like if you deploy that right and are able to assist nurses in maybe picking up on clues earlier, and we're preventing codes, we're preventing these poor outcomes. Now you can't prevent all of them, obviously you can't control everything, but to know and have those kinds of clinical support to help help with clinical decision making or predicting things, or hey, take a look at this, and continuing to fine tune that. That makes me feel like in 5-10 years, patients are, getting out of the hospital much faster,
Yes.
getting care earlier, intervening much earlier, to prevent some catastrophic things, which also I think helps with the morale of the bedside nurses and the I am making a difference. And so that would be a very bright
Yes.
future in my perspective.
Absolutely. And I think, that bright future, the other thing I would envision is that nurses are leading in this space versus just being the recipients of what
Mm.
happens. So I think we will get there if nurses, I'll say when we lead in that space, we will get there. We have just this amazing opportunity ahead of us to truly transform healthcare delivery. And
Yeah.
nurses, who better than nurses to do that,
Oh yeah.
right?
I think there could be, if nurses take ownership of AI, that would be even more transformative
Yeah,
than just,
yeah, yeah,
AI in general, but nurses saying we're gonna take ownership of how this will impact, improve our outcomes, protect our patients, and transform our care delivery. That I
yeah.
think could be very, very, very powerful. And there's so many people who get into nursing and love it, and then decide they get into it with such a altruistic and like very much want to help people, and then those things that really burden them, I think, are things that AI can really help mitigate. And so you
Absolutely.
keep people in the profession that are good nurses that want to be there, that can provide that great care, and we kind of have more of a protective, like, hey, yeah, we're going to own this, and we're going to give our patients the best care and leverage this as safely as possible. Because man, when I love how protective nurses are of their patients, and especially when it comes to new things. People are skeptical because of fear, because they don't want bad things to happen with their patients, and don't want to give up control, which
That's
I very much
exactly right.
understand. But if
That's
you have
exactly right.
ownership over it and you're protective over how it is implemented and optimize it for patients and nurses, I think that is a very bright future.
Absolutely. And of course, we can't do it ourselves. So I think
Yeah.
that, this is the era of partnership and partnerships. We have to acknowledge, not only in nursing, but in healthcare, we are very siloed. And, um, and you were asking about nursing education. That's another kind of, we have to create these partnerships with education, with technology, and then within our organizations, we have to do the same thing, so that we can be the conveners of that. We can inform the processes. We can inform how best to use AI in nursing. We can do that and do that with those partners.
I love it. Well said. And then if you are doing, if those as administrative, those tasks that AI can take over, boy, how much more brain space and time do you have to really, as a nurse leader, lead your team, as
Yes,
as a bedside nurse, provide the care that you have been hired to provide and like
yes,
know you can do. I feel like we can all work better together when we're not inundated with those things. So,
yes,
well,
yes.
Dr. Grant, it's been great talking to you. This has been so insightful, and I'm really hopeful, I'll have you back on the podcast and you'll be telling me more about, hey, we had all these
Wonderful.
successful things of AI, and these are all the great things that it's doing. And here's some things that we learned that, didn't go well, but we're hopeful for how much it can improve patient care.
Absolutely, absolutely. Well, I look forward to it, and I so appreciate you doing this, Katie. And it's been a real pleasure being on the podcast. So thank you for inviting me.
Thanks so much for tuning in to the FreshRN Podcast. If this episode gave you something to think about, or maybe made you a little more excited about the future of nursing, be sure to follow or subscribe so you don't miss what's coming next. If you want more support between episodes, head to FreshRN.com/email-updates to join my email list. That's where I share my best free resources, insider updates, and you'll be the first to know when enrollment opens for my new FreshRN Med-Surg residency program, a step-by-step bridge from school to becoming a competent, capable med-surg nurse. And for nurse leaders and educators listening, stay tuned. We're building an enterprise version of the residency for hospitals and academic partners launching in 2026. If you found this helpful, please like, share, or leave a quick review. It really helps other nurses find FreshRN and keeps the conversation going. So thanks, nurses, and stay fresh.